Senator Uresti.
Thank you, Mr. Chairman. Thank you all for your hard work. I just have a couple of questions. When you mentioned in your PowerPoint the refugee camp for the average wait in a refugee camp is 7 years, that's
Yes.
one incredibly long time. Is that in their country of origin? Is that in another country? Where would that take place?
Right, typically outside of their country of origin. For them to be given official refugee status, they have to flee the country that they're originally from. There are some special programs, like the Special Immigrant Visa Program, where folks may be coming directly out of Iraq based on their service. But in most cases, they're in refugee camps outside of their country, and there has been data about the length of time that people are displaced has been increasing in recent years, unfortunately, as crises are more and more protracted.
So during that average wait of 7 years, is that when the process starts? That I think we heard earlier it takes almost 2 years. Is that when it starts?
Right.
Or during that 7 years?
Right. When someone initially flees their country, they register with the United Nations High Commissioner for Refugees, and that's the initial step. And there's a case file that's open for them, and they're interviewed, and their story is documented. At some point later, which could be many years later in the case of the Bhutanese or the Burmese refugees, decades later, there are international agreements that are reached about those host countries integrating some of those refugees into their local communities, and resettlement countries, 28 of them participating in this program globally right now, that will agree to take a certain number. And then once that's triggered, and say the U.S. agrees to take a certain number as part of that international arrangement, then that's when the U.S. process starts. And that's the process where the 18 to 24-month figure that you've heard in the past would begin. So that's typically several years after, and already after they've been through however long that UN process may take.
I see. My understanding is that some of the refugees are survivors of human trafficking. Is that correct?
Correct, yes. Survivors of human trafficking are eligible for many of the same services that our refugee clients are. So as they are identified, but they're, the survivors that we are working with are identified in Texas, in Austin or around Austin, and so that's where the police department is taking action, or a law firm, and then they're referring to us to assist them through the process of getting that status clarified and then providing services to them. Yeah.
Okay, thank you.
Chairman. Senator Perry.
Thank you. You engaged me in your testimony there, so unfortunately you put me in an unenviable position of either questioning the reliability of your data, and I do not, or requesting the reliability of the state, and I really do not. Somewhere in the middle there's the truth.
Sure.
So that wasn't something I pulled off the top of my head. Roughly 26% is what the state's data shows. Number two, are you 100% federally funded? You're 100% jurisdictionally under the federal control, correct?
Correct.
So the state can come up with any initiative, Senate bill last session, to encourage coordination. But honestly, there's really nothing that we can do as a state to force the communication and coordination. And as your former witness there testified, that's not happening. So we can sit, and I'm not anti-refugee, and I'm not anti-program, and I'm not anti-you, but I also sit in front of these panels every day and hear how great of a story we're all doing on lots of different levels when the facts don't support it. So we can acknowledge there's a program in place, that it's probably too big and unyieldy to be efficient. It's probably effective on some level, but lacking the communication and coordination with the local communities, the cost of that program will ultimately fall on those individuals. And so I appreciate your perspective, but when you engage me on my numbers, if you will, and they weren't my numbers, they were numbers from people we hire as a state and have cost involved in that delved to those numbers, then I would be careful going forward in other testimonies to challenge those numbers. And so I don't do that to be mean-spirited. I do that to set the record straight. That's one of our problems we face in this state and all government is, what do you believe and when do you believe it? But I do have a very credible individual here that has stated very clearly the communication that we sought as a state that we think is critical for this program to work and provide security and safety for its citizenry, and to make sure that those services that are being paid for at the taxpayer level, be it federal or state, there's only one taxpayer, are being delivered properly. So you can leave here with the idea that you say it's being done, and you'll look at the hot spots that aren't. I can tell you, I would think that his testimony is consistent throughout the state, possibly, that communication is lacking. So maybe not.
May I respond?
Okay.
Okay. Just to break down, it's certainly no challenge, Senator. I apologize if it came across like that. The data that we have from the state, I believe it's accurate as well. However, the way it's broken out, there's male and female. Now, a portion of those male clients are children. So if you add up the number of children and then you add up the number of women, and then you are at over 65% of women and children. And so that's the statistic, and we have that statistic. We'd be happy to provide it of our clients at any time. And we've heard for the refugee populations that have not come to the United States that that's an increasing percentage, over 70%. Syrians, over 75%, women and children still. So I understand, and I don't challenge the stats. We rely on the state data frequently ourselves. So it's just the way it's broken out in that presentation that there's a question there. On the issue of community consultation, we do communicate. We have quarterly meetings in every city where we work with our community stakeholders, and we have those. We have minutes. We have sign-in sheets. It's something we've been doing for years, and one of the reasons we supported in spirit Senate Bill 1928. We believe in community consultation, and we believe that it's important. As I mentioned, this program works best when everybody has the information they need, and that we're able to work together constructively. So we want that, and we're going to continue to invest in it, and where Mr. Mayor feels that that could be done better, we are in real-time communication about that, and we will continue.
You're saying consultation and communication, but it's coordination is the right term according to the federal statute, the federal code. How is your agency actually coordinating with the city as well as the state? It's not just one entity, but two entities regarding their judgment as to whether or not a locality can accept more refugees, and is it being done prior to those refugees even arriving? What is the coordination from your point of view? Describe coordination in your eyes.
Sure. State level, we are in daily, if not daily, weekly communication with the state office at HHSC.
Are you saying that this is the number that we anticipate trying to resettle here in Texas at this location at this time? And then, is that correct?
Correct. Yes, that conversation happens on an annual basis.
Annual?
Annual. And that we're scheduling that right now. That'll happen this week or next week to have that conversation. Now, in the case of a place like Amarillo, which has, challenges that we want to be working more closely together, those conversations are more frequent. So that's not an annual conversation. That may be quarterly or just more frequently than annual.
Do you want to give some insight into what was just said regarding the coordination with the local government as well as the state of Texas regarding the awareness of the refugees, the number of refugees, and where they're going to be located in your
City of
experience?
Amarillo has had zero impact on that number while we've talked about it since I've been in office 5 years. There were no records of prior meetings with any city official other than maybe where their job intersects with public health. There was no consultation with any government agent. It may have been an administrative interaction, but not with elected officials at all. It's not on the radar of 99% of the mayors in the country. It came on our radar when a group of Somalians came and asked me to intercede in some legal things that we couldn't do, and we started to study it. I would like to see the files, because we do not have any files. They have had in the last 3 years a couple of consultation meetings. It seemed as if there wasn't coordination between the two agencies, so I asked as mayor if I could begin to coordinate those. We had one in January of 15, one in April of 15. We did not have one since then. They have recently, I think, probably due to this act, have asked us to re-engage. I've been told by people that they have asked that I don't come. They don't like me interfering with the meetings.
Is that true? Have you asked him not to come?
I am not aware of comments to that nature.
I am.
As the chief executive officer and the highest elected official in the city, you'd be intimately involved, I would hope and expect. Well, that's unfortunate that the coordination, and at least in your eyes, Mayor, does not even include notification, and certainly much less an actual input as to the
Let's see the
number
sign-in
and
sheet.
location of those
Sure.
refugees.
Let's see the sign-in sheet and the documented minutes. I'd love to have them.
The issue of licensure of the placement agencies, I'd just like to get your opinion. I'm sure you don't think y'all need to be licensed by the state. I'm just guessing, but give me your opinion.
Well, I was reflecting when that came up earlier. We were monitored 30 times last year by the federal government, by our national partners, and by the state office for the programs.
But there are many entities that are both federal. For instance, I have a federal DEA license as well as a state license. And there are many, many entities that are both federally and state regulated. Why should all be such exclusive special entities?
Right, it's a fair question. I don't feel that we feel that way. Heather may have some comments, but we want to be as effective partners as we possibly can be with the state. So, you know, again, the communication is frequent, the monitoring visits are frequent, the technical visits are frequent, and I feel whatever works for everybody is we want to keep pursuing that. I don't know, I'm not an expert on licensing and all the ins and outs there, but I just do know how heavily regulated we are now. And we understand that. It's public funding, and we need to be responsible for that. I know how frequent it is, and you know, if there's questions around that, again, we'd be happy to provide more information. I do want to say one more thing, and again, I have so much respect for the mayor and for the city of Amarillo for all the work that they've done. We did have a pivotal meeting in Amarillo with Congressman Thornberry and representatives from the Department of State that came down in September 2013. Since that time, the only refugee cases that have been resettled through the federal program are family members joining other family members. So family reunification cases, U.S. at 100% since 2013.
In Amarillo, you mean?
In Amarillo specifically.
Right. But Abilene's picked up threefold or so from what.
Yeah, I don't know the details in Abilene, but I do know that we were responsive as we could be, and with the challenge, and this is where there are challenges in the system, is that if you have a family member who's approved to be resettled in the U.S., and that's a years-long process with 50 different checks and everything else, so that the light has to go green on all of them at the same time. When that happens, and you say Amarillo isn't ready now, then they get sent to Buffalo or they get sent to California. They will move to Amarillo in pretty short order, and that's pretty heavily documented. So this program, there's a design for that federal funding to go to that arrival point so that we have resources to invest, to integrate and support that integration, to take some of the burden off of the local community. And when you send them somewhere that they don't want to go, that they said that they'd want to go here, but we send them somewhere else, there's inefficiencies in the system, and some of those tax dollars get lost in the process. And we don't have great data on secondary migration either. I think the state office may have some better data, which could be helpful, but it is a challenge, and it's one that we struggle with too, as they don't check in with us when they arrive, but we hear, growing numbers in the community, and so we want to be, again, part of that, the solutions in responding to that, but it is, there is a tension point in resettling a family member elsewhere when you know where they're going to end up shortly thereafter.
It's not unlike, I guess, the resettlement. Flint, Michigan, I think, is a town, or Dearborn, Michigan, noted for resettlement of Muslim population because that's where originally the original settlements occurred. If I'm not mistaken. Is that correct? Do you know any?
And about Michigan?
Yeah, Dearborn, Michigan, and Amarillo, I guess, is a micro example of that in Texas regarding when you start a resettlement program in one geographic locale, you're going to get, even if you try to resettle in a different geographic region, you're going to get those individuals secondary migration into that town or city.
Yeah, and as was raised before, a huge part of that story is the meat processing facilities in Amarillo
Yes,
that recruited specifically, and that was even before we worked in
Right.
Amarillo, so we were kind of a response mechanism to.
Sure, it's a lot longer than that, probably. The other issue is the issue of just a secondary check just by the placement agency. Or do you rely completely on the federal government's multi-stepped, although I think right now they have an expedited process for Syrian refugees, from what I'm being told and understand, that is abbreviated relative to what was described by Senator Rodriguez. But the issue of just the placement agencies having any sort of internal processes, do you know, you're just 1 in 19, I believe, right? Do you all have any internal process to do an interview with the individual to understand their background, pick up on anything that might seem odd, and what do you do with information that might be concerning to your agency? How do you all handle that whole process internally?
Yeah, absolutely. There are two steps in that process after they get on the plane to come to the United States. First is they have to go to a port of entry in the U.S. There's 5 of those only. And so in each of those 5, there are specific trained staff to vet the documentation and to make sure to do that double check once they're on U.S. soil. So there are 5 of those, and there's investments made there. Then, once they're cleared through that port of entry, then they get on a second flight, typically to their final destination. And then within 24 hours, we're required to do an intake with them in our office. We have to do a home visit, and we have to do an intake where we, again, go through their documentation and verify and talk to them about their background. We have to get started very quickly to get them to work because the initial benefits they receive are time-bound. So an intake on their background, what they've done in the past, what type of work they may be more ready to fill quickly. But we do go through their documentation, and if there are anomalies identified, then we have to report that immediately up to our national partners, the 3 I mentioned.
Not law enforcement in the local area, but up your national agency.
Correct. That's not been a standard practice. Standard practice would be reported up nationally, and then that goes to the State
Have you all had
Department.
to do that at all?
Have we had to do that? That's a good question. Not to my knowledge. I know there are anomalies that happen, unfortunately, there are medical issues that aren't reported on arrival, like they might have needed a wheelchair, and we didn't know that, so we didn't get it. So that's something, I know we've reported things like that back up. I'm not familiar with any issues of their documentation not being in order or things that might trigger a security concern.
Where is Refugee Services of Texas located, headquartered?
The administrative office is in Dallas. I live in Austin, so I move around.
You live in Austin, the service is headquartered in Dallas, and is Amarillo your largest placement?
No. Our largest placement site is in Dallas.
Okay.
Thank you, Mr. Chairman. I have just 2 questions. You mentioned there have been economic impact studies done. Can you supply us with those?
Sure,
And
absolutely.
what do those generally indicate?
Right. The government of Tennessee, state government of Tennessee, commissioned a report that looked at the period of 1990 to 2002 and found that they looked at revenues and they looked at costs, and they found that from their estimation, the revenues were about double of the initial costs that they identified to serve refugees after their arrival. The one out of Cleveland was, the results were different. They found almost a 10-to-1 return for the city of Cleveland in terms of the initial investments. I don't know, it must be state investments, but 10-to-1 return on the revenues.
Nobody has done studies here in Texas?
Right. There is a study that has been initiated by UT out of San Antonio, and they've done some initial groundwork on that, and we certainly would like to see that continue. And again, their initial findings echo some of these other reports that I mentioned.
Preliminary findings, you say it's not being completed then?
Correct. Preliminary findings, yes.
Okay. No national studies?
Not that I'm aware of. I'm not sure if Heather would know that.
Okay. How about on the concern that we have about community safety? Do you guys do any data retrieval or studies on criminal conduct on the part of refugees?
No, we do not.
Does anybody?
If we, I don't.
I know that local law enforcement probably does it within their area, but I'm talking about just somebody looking at refugees in particular to see what kind of threat they pose and whether they're engaged in criminal conduct and to what extent, to what level.
Sure. If one of our active clients that we're actively working with did have a law enforcement issue, we certainly would be aware of that. I don't think I can recall any example of that ever happening. But I don't know if there's another entity.
All right.
Are there any restrictions on placements in the state of Texas? Where do y'all operate? How do you decide your geographic boundaries?
That's federally mandated. If it's a case that has a family reunification component to it, then there's a 100-mile radius around the city where that office might exist. If it's a free case that has no, or a non-U.S. tie case, it's a 50-mile radius.
Okay. Are there states that have any input regarding if you don't participate in the program like Wyoming, then have a refugee resettlement agency in that state, then there are no resettlements unless the state were to have a program. But my understanding is Wyoming is the only state that doesn't have refugees because of that. Is that correct?
I wish I knew more about the Wyoming situation. I am familiar that there are not or are very few resettlement cases that have ever gone there, but I don't know.
That's not because of state action or because of the lack of placement agencies? You don't know that?
I don't know the background on that. I'd like to.
Mayor, you want to have a comment on that? Y'all were talking, I'm sorry.
There is, I think there were 3 states on the map that I brought that showed no resettlement. The raw numbers vary state to state based on population dramatically, as when you ask the question, where did you settle the most? So obviously the most is in Houston. In a larger population per capita, we are still 2.5 times higher than anyone else in the state of Texas, and so it is a question. The other question I would have is, I cannot get a clear definition of family. If you ask the State Department, it's very loosely interpreted. So when they talk about family reunification, it is not as we call our uncles, cousins, aunts, brothers, sisters in the United States. It is defined more in a tribal basis. The talk about family...
Is that correct? Is that, in your understanding, is that correct?
So the terminology is U.S. tie or non-U.S. tie, right? So that's the determinant for the location that they will
I'm talking about the family definition.
So the family definition, right. It typically is a direct family relative. There are some cases, as the mayor alludes to, which may be a cousin or a more distant. And again, in most of those cases, we'd be talking about folks that have been living in a refugee camp for 20, 30 years next door to one another. So, if there's not a blood relation, it certainly is familial and a draw. So that's why, again, and they're asked 3 times during that overseas processing mechanism, is there a location in the United States where you know somebody or that you'd like to go? And when they state at any point during that process that, yes, I'd like to go to Amarillo, then it's tied at that point.
Mayor? Yeah. Senator Perry and then Senator Campbell and Senator Colpers.
I'm not familiar I'm not surprised at the definition. That's kind of been incorporated in some of our other immigration policies. But so I want to be clear, and I may be mistaken on this, but I'm not sure Tennessee has Medicaid. I'm not sure. I think it's the only state that maybe doesn't, but that may not be the case. But I want to be really clear that these cost data, does it include the local cost, the school districts, all of the cost when they're doing these comparisons? So I would like to have those studies too, but my gut is probably not. Just simple math. Average per capita sales tax collected on an individual in the states, roughly, last number I saw, $1,700 a year. Are these people getting high-income jobs, probably, when you're finding placement opportunities for them?
The highest paying jobs are in Amarillo. The average starting rate for our clients there is $12, and I have that $12.
So they're roughly $26,000, $30,000 a year incomes. So if you do the state sales tax number and then you multiply the 25,000 refugees we currently have, you can get to different math is my point. So I want to make sure I get those studies and that they're apples to apples. There's no way that if we're out $138 million as a taxpayer, state and federal, that those costs can be made up. I want to go back to real quickly your role and you said there's an intake. Is there a protocol established within your guidelines of operation that in the event Joe Smith sits in front of you and he ain't anywhere close to what you're looking at, what is there established protocols that y'all have been trained to follow through on, or is it just kind of discretionary?
We would pick up the phone right away and contact our national partner, and then I'm sure they would pick up the phone right away, call the State Department, and then we'd...
I just wanted to make sure that there was a formal process what you're trained on, but on the cost data, please get me whatever you've got coming, but I want to make sure it includes the costs that the 9/11 service and the translation service and all of those other variables. But just on pure and simple math, with what I have seen from the comptroller in years past, it never adds up. And I can quote studies that show the contrary. Heritage will tell you that it's a net $14,000 cost for every illegal undocumented, and you can make a correlation that the job and income opportunities and things are probably similar. So, I mean, that's the problem with data. It's all on who is developing it and for what agenda.
If I may, we would welcome additional studies to be done on that as well and support it.
Aaron, I wanted to ask you, you said that all refugees have to be, they first register through the United Nations, and they go first to a refugee camp, then they get registered by the United Nations. How do they make contact with the United Nations at a refugee camp? At least the ones I see on television, there's not a, how do they do that?
Sure. They don't all go to a camp. I should highlight that.
Oh, I'm sorry, I thought you said
that's
they
okay.
all have to go to a
right.
camp.
Right. Sometimes there's an urban refugee context as well.
So they're just in an urban setting in their town and they go to a refugee,
To an office.
a United Nations, and they say that they're being persecuted in some way.
Yeah.
And they have family members here that were also persecuted?
Mm-hmm.
I mean, is that why they were here?
Everyone that comes through this program had to meet the eligibility criteria as a refugee.
But they happen to have family in, like Amarillo.
Yes.
That met the same, I mean, were they repatriated here?
Right.
Wonder
Correct.
why they didn't all go at the same time.
A lot of them do, but they don't all go through the process at the same time. You know, sometimes it's a phased thing. Again, as I mentioned, there are so many different steps in the process that all need to be approved at the same time.
All right. What was the special immigrant visa program? That's what allows them just kind of directly to come over here?
Right. That's for Iraq, specific to Iraqis and Afghan individuals that have worked with the U.S. military for a length of
Where
time.
it's documented they actually worked with us.
Correct. And there's a military officer that typically verifies or approves that application.
And that's the special immigrant visa. The jobs that they get, how do they get a job?
We have
With TW
an
Workforce?
employment. I'm sorry?
Are they partnered up with the Texas Workforce Commission?
That happens on occasion, but typically, well, each of our offices has an employment case management team in it. Some of those resources are what comes through HHSC Texas from Office of Refugee Resettlement, and then we also have another federal program that comes directly from our national partners to get them employed as quickly as possible. Our case management team is really the front line on that, again, understanding their background.
And if they come over with a specialty, for instance, the 72-year-old that wants to be a CPA because he was there, so do y'all partner, try to get him his CPA certification in America?
Right. Eventually, 99% of the refugees that arrive, they have to take the first job we can get for them as quickly as possible.
Because it's a requirement
to
get a
get
job.
into the work experience.
It'd be nice if our other, people unemployed could get a job that quick. Partner up with. The, and ongoing services that I saw, those are all paid federally, by federal dollars?
And private donation support.
Community gardening?
Mm-hmm. Yeah.
Okey doke. And it said that they have to fill out papers, you know, to become a citizen. I noticed that.
Correct.
What if they don't want to become? I mean, are they ever not repatriate, do they ever go back to their own country after changing government, or?
I believe there have been a few cases of that, very rare. So
That's what I would expect. Thank you. Thank you, Mr. Chairman.